This segment is brought to you by Busamed Hillcrest Private Hospital.
Dr. Gangaram, thank you for joining us on Living Your Best Life.
Thank you for having me here.
So you run a center called the Pelvic Pain Center. Please tell us a little bit more about that center.
Yeah, so we run what is called the Pelvic Pain Clinic. It's quite unique because it's one of its own in KZN. It's basically a clinic that's directed at helping people who suffer from chronic pelvic pain. The reason for having the clinic is it affords a multidisciplinary approach to pelvic pain. So we are a clinic comprised of a gynecologist, a urologist, a psychologist, a physiotherapist, and even a homeopath, all with a special interest in pelvic pain. And basically we're directing at providing a holistic approach to this problem and providing continued support to patients or long-term sufferers of chronic pelvic pain.
So you are a gynecologist and you deal with women the entire day. Let's talk about some of the things women suffer with.
Sure. So the common problems women have is often they have problems with abnormal periods or variation in their menses, be it heavy, be it absent. Then we have patients who present with pain, and pain may be due to cysts, which are relatively common these days, and endometriosis is another common problem that we tend to see.
I'd like to discuss endometriosis, if you don't mind. So can you define what endometriosis is?
Sure. So normally the tissue that lines the lining of the woman's womb or uterus is called endometrium. And when that kind of tissue is found outside the uterus, we call it endometriosis. And the common places is often behind the uterus, on the ovaries, on the fallopian tubes, and sometimes it can be found in distant sites.
What are some of the symptoms attached to endometriosis?
So the common symptoms are pain. So pain during the menstruation or just before and during the menstruation. In certain circumstances where it's severe, it can be even when you're not having your menstruation. You can have pain during intercourse, bleeding, irregular or heavy periods is another symptom. The other sort of symptoms, sometimes if it's involving the bowel or the bladder, the patients can present with bowel problems, blood in the urine. And the other common scenario we see women with endometriosis in gynecology is it is a cause of infertility or subfertility.
What are the treatments available?
So treatments depends on what the main symptoms are. So if your main problem is pain, one is, if it's not too severe, one can start with a normal anti-inflammatory, and that is more to just treat the pain rather than the underlying condition. One of the things with endometriosis is it is estrogen driven. So as long as you're seeing your periods, your ovaries are functioning, you're at risk of endometriosis or it's progressing. So the treatments are directed at sort of decreasing the estrogen levels. So one is using a contraceptive pill. Two is there are drugs like Visan these days, which are progestogens, which create a low estrogen kind of environment, which suppress these endometrial deposits. And then there are other drugs such as GnRH analogs, which again create a kind of a medical menopause. But the problem is they create all the other menopausal side effects, so they can't be used long term. So those are the basic medical treatments. The surgical treatments, and this is more in women where fertility is the main issue. So if a woman has a big endometrioma, which is like a chocolate cyst of the ovary, then one goes and sometimes drain it or remove the cyst. But generally surgery is the mainstay if a woman is trying to conceive, because your fertility improves after surgery.
So if a patient is diagnosed with endometriosis, is there a lifestyle change that is required?
Yes, so when one has endometriosis, the first problem is often the average patient may take 7 years from the onset or presentation of symptoms to being actually diagnosed. So many of these women have gone to various kind of settings, and often they're not sure what is wrong. And two, also socially it's affecting them because they're taking time off from work. People are not so understanding. Other women are having periods. What is wrong with you? Why are you complaining? So it affects their relationships, their work, their friends, their whole circle. So when you get endometriosis, the first step is understanding what is wrong with me. There is something wrong with me. Two is one needs to institute treatment, and there is medical treatment, be it one of those hormonal treatments or be it surgery if necessary. Then there's a lot of evidence that diet may play a role, and certain things or diets rich in estrogen like soya products, lots of dairy, etc. may worsen it to a certain degree, so one needs to modify your lifestyle. And then one needs to develop better ways of coping with the pain. So be it yoga, be it meditation, whatever kind of can provide a distraction from that pain instead of reaching for the next pain drug or pain medication.
That was very informative. Thank you, Doctor, for joining us on Living Your Best Life.
Thank you. Pleasure.
Busamed Hillcrest Private Hospital is committed to promoting a safe, cost-efficient, and quality healthcare service to all patients. They strive to build a secure and integrated relationship between the staff, medical practitioners, and clients at Busamed Hillcrest Private Hospital. There is commitment to providing excellent care to all customers.